with G Money on every mobile network. Hello everyone, it's your rockstar Kwame Eugene. When I'm performing on stage, I prefer to work with a band that knows and understands my music. Together, we create a synergy that blows the roof. Likewise, in my day-to-day transactions, I rely on G Money because it aids me with smooth and secure transactions to all networks and banks. The G Money mobile wallet is powered by GCB Bank. It is the safest and most secure wallet. With G Money, I'm always the G that gets things done. I am able to quickly receive and send money to my loved ones when needed.
Be a G like Kwame Eugene. Walk to any G Money agent or GCB Bank branch near you and sign on today with the Ghana card. Dial *422# and make transfers to friends and family on all networks without hassle and experience a variety of packages on G Money. To be a G Money agent, walk into any GCB Bank branch and get registered. It pays to be a G, so be a G. Tratum with G Money.
Roverman Productions, in partnership with National Theatre and Joy FM, presents The Secret Code of Wives, an Ebo White play.
And if really you want a divorce, I will give it to you. But on 3 conditions. Condition number 1, you will divorce me the same way you married me. We had a whole ceremony for our wedding, and we are going to have a whole ceremony for the divorce on the same scale as the wedding, with music, preaching, caterers, photographers, and in church.
You are crazy. Whoever heard of a divorce ceremony in church?
Well, if you do not meet my conditions, I shall make this divorce your worst nightmare in court. And we are both lawyers. You know what I'm capable of doing in court.
The Secret Code of Wives shows at the National Theatre on November 27th and 28th and December 4th and 5th. Time 4 p.m. and 8 p.m. each day. Rates 80 Ghana cedis. Tickets available at *713 *5 # and at Airport Shell, Tema Community 11 and Dansoman Shell, Joy FM, Hacho and Bachana Total, Frankie's, Osu and Say Cheers, Accra Mall. Proudly sponsored by Gino, Dolphin Finance and Total Family Health Organization. Roverman Productions. Be the difference.
Pino! Wake up, nothing can hold us down. Get up, born to wear the crown.
Maudada no pediani bianya di pa and the pe wo malt, milk, and a cocoa moi and mamilo muda shima.
From Nestle.
Every ashe side to the nkatu mu agya to say eye.
Fellow Ghanaians, and the measures put in by government in response to the novel coronavirus disease, which has so far affected some 118,000 people across the world. WHO has now characterized it as a pandemic.
Coronavirus, COVID-19,
Coffee in your cup. Join us and Super Morning Show is always the best
papa, baby, I say, baby, African Sudan grass and baba. Share, Soja Sudo Corona, Lawyer Osuro Corona, Malam Sudo Corona, Wala Wapaste Osuro Corona.
All right, so we're going to get some clarification on a few things to do with COVID-19 vaccines and learn a bit about what's happening around the world with the virus. Our guests, Franklin Asidu Bequin and Kwame Sapon Asidu, join us on Zoom right now. Good morning, gentlemen.
Good morning, Kojan. Good morning to your listeners.
Wonderful.
And good morning to Kofi as well.
Excellent.
Yeah, good morning.
Great. It's great to have you both. It's been a while. So big stories are coming up now, and it's all about the COVID. And it's brought to you by GCB, your bank for life, Vodafone, Together We Can, and Latex Foam, your partner for life.
And are you looking for sofas made for comfort, durability, quality, and that perfect finishing? Do you want a 1, 2, or 3 shaped sofa crafted to the finest details and available in various colors for your homes, office, or hotels? Are you looking for a student, orthopedic, queen size, double and single mattress or pillows to buy? Look no further, because Latest Foam is Latest Foam is actually offering 10% discount on all products at Latest Foam showrooms till the end of November. The general public is encouraged to take advantage of this Christmas offer. Latest Foam is your partner for life, but please be careful with persons on social media who are posing to work for Latest Foam and duping the unsuspecting public. Latest Foam, does not do delivery to individuals. So please ignore any request on social media that you should send money to and then items will be delivered to you. Deal with latest foam at our showroom and authorized agents and ignore the criminals on social media.
Well, experience real-time customer care at your convenience using Vodafone Ghana digital channels. Pay bills, send money, buy airtime, make enquiries, and more on My Vodafone app. Toby and DigiCare. Download My Vodafone app on Google Play and App Store. Say hello to Toby on WhatsApp. And here's Toby's number on WhatsApp, 0501 You can SMS on 655. Facebook Messenger and on DigiCare. Visit myvodafone.vodafone.com. Vodafone.
Now, what's new in the all-new Close-Up Everfresh? I'll tell you, it now has a triple fresh formula that cleans, protects, and cools. Thanks to the powerful combination of 1. A purifying gel, 2. An antibacterial mouthwash formula, 3. Ice-cool crystals that clean, fight up to 90% bacteria, and intensely cool. Keep yourself protected and fresh long after brushing. Close-Up Triple Fresh Formula cleans, protects, and cools.
And it's a mega sales at Furniture City. Something big is happening at Furniture City this Friday. Furniture City, Ghana's largest furniture store, is giving you the chance to have a complete home makeover. Visit Furniture City today, Friday, 26th of November, and enjoy a minimum of 20% to 40% discount on all items. And look out for that big surprise for you and your family. Locate Furniture City on the Spintex Road, 200 meters from the Flowerport Junction. For more information, please call them on 0244 213 333 or WhatsApp 0540 314 948. Furniture City, home of quality furniture. And even before we get into our conversation, Kojo, the multimedia group, has collaborated with the Ayawaso Central Ghana Health Service to administer the first dose of the Pfizer vaccine to the general public, especially those who are yet to be vaccinated against COVID-19. So we have nurses on our premises, and they've been there. They've been here since November 23. Today's the last day. They are the car park annex down the Fanofa Road in the curve after the traffic light. Remember to bring along your national ID card.
All right then. So let's get into this thing and get some clarity and clarification on some issues. Dr. Franklin Asiedu-Bekwai, I think it would be good to start with you. There is a document making the rounds. It's supposed to be from the National Schools Inspectorate Authority. I'm just going to read what it says. It's signed by Hagar Ampedu, Dr. Hagar Ampedu, who is the Inspector General of Schools. And it says, it's dated, first of all, the 19th of November. And it's under the heading Vaccination of Persons Aged 15 Years and Above with Pfizer-BioNTech COVID-19 Vaccine. And it says, as part of measures at halting the spread of COVID-19 in schools and among the general public, the Ghana Health Service has planned to vaccinate all children aged 15 years and above as soon as possible to increase their level of protection against the virus. According to the Ghana Health Service, the Food and Drugs Authority has granted approval for extending the use of the Pfizer-BioNTech COVID-19 vaccine to cover children from 15 years and above. We are by this letter requesting all private school associations and school leadership to work closely with the regional and district directors of health to facilitate the vaccination of all learners aged 15 or older in all private schools across the country. Counting on your continuous support. And then it's got the signature and the distribution list, of course, the minister and his deputies, NASIA's board chairman and chief director at the Ministry of Education, DG of Ghana Education Service, and so forth. Now, the question that I would like us to get an answer to is this mandatory? Has the government made a decision to mandatorily vaccinate all children 15 and above?
Yes, thank you very much. Let me say that the goal of the president is to ensure that all Ghanaians are vaccinated, are vaccinated. But this is based on the premise whether the vaccines are eligible for particular age groups. So if you look at the initial drive, we targeted about 20 million Ghanaians because at that time the vaccines available were for persons 18 years and above. With increasing evidence, some of the vaccines have actually dropped their ages. So as I speak, I know that Pfizer can be used for people between 5 to 11. But most of these vaccines, you use them based on emergency use authorization. So for Ghana, as I speak, we have 5 vaccines that have been registered. So we have Pfizer, Moderna, Johnson & Johnson, AstraZeneca, and Sputnik. So we, based on the evidence available, the ministry made an application to Food and Drugs Authority of Ghana that we need to consider persons 18, 16, and 15 years up to 17. And Food and Drugs Authority has actually given the approval. So for now, all the other vaccines are approved for 18 years and above, whilst Pfizer is for 15 to 17. And that is the direction. If you look at that age bracket, let me say that the risk of, let's say, severe outcomes of COVID correlates with age. So this is very minimal, under 5, then 5 to 14, then 15 to 17. That's where we have graduated our ages. So that age group, I would say, is the third category. But they are also a very vibrant and very mobile population. And though they may not have severe disease, they are also high spreaders of the infections. And these are people who actually reside in the boarding houses. And when you have an outbreak in the boarding house, it could be very, very severe. So based on that evidence, we think that is good to vaccinate them. But let me say that it's actually an opt-out option. So, but based on evidence that we have, we think that vaccinating persons 15 years to 17, the benefits far outweigh any possible risk. Thank you.
All right. So to be clear, you're saying that there is an option for students or young people to opt out if they do not wish to take the vaccine.
Yes. So let me also say that I think that very soon the minister will be coming clear with certain kind of mandates across the country. You see, this fight against COVID is not ending now. And the government has a lot of responsibility to ensure that majority of Ghanaians are safe and going about their activities well. So when you talk about public policy, it's for the welfare of the general population. There may be few who will be out of it, but majority of Ghanaians must benefit from public policy. And that's what we are looking for. And there's a clear evidence of the effectiveness of vaccine, even Pfizer, even as low as 5 years.
Okay, I want to get the clarity for parents. They are the ones who have been asking these questions, sending us text messages. They want to be clear. So permit me to get that aspect of this quite clear. You are saying that the students can opt out if they do not wish to take this vaccine.
An opt-out option.
All right. But have you communicated to parents that this is happening?
No, so I think let me say that this is a cooperation or an activity between Ghana Health Service and Ghana Education Service, and then likewise with the PTAs. So that information has been communicated, and clearly it's about the benefits of getting your child vaccinated against getting a disease that may cause a bad outcome. So that is the drive, and it's like giving HIV in pregnant women. It's an opt-out option. So majority people opt in and they get tested for HIV when they are pregnant, and that's what we are hoping to do. Majority of the children 15 years to 17 are opting in to be vaccinated to prevent outbreaks that may occur in schools.
Yes, but the point of an opt-out policy is that people must have the option or the opportunity to opt out if they wish. Now, if they are not informed, then they can't exercise that right. And parents are telling us that they are not informed. They are.
You see, I think let's look at the issues. You see, there's a lot of information that I have that I think we need to share. You see, now Ghana has several vaccines. Our challenge was we were not having vaccines based on the efficient deployment system that is in the country. Partners, countries are giving us several doses of vaccines that we need to deploy. And we are grateful that Joy FM has set up a stand to make sure Ghanaians are vaccinated. That is the drive. As I speak, we have about 4.1 million doses of vaccines cumulative that we need to deploy. And that we should all focus in that direction. How do we get Ghanaians to take the vaccines? I think that should be the focus of Ghanaians. And let me say that this issue about children coming on board is for the best of the children in Ghana. That is the government decision. And as far as you're concerned, the service, the Ghana Education Service, are working together with the parents and we're giving the leeway. There's an option out.
So, Dr. Asiedu Bekwing, do parents have to consent?
Yes, you see, as I said, this whole idea of vaccination is normally children go to schools and they are in the care of, let's say, the school authorities. And the school authorities have an association, the Parent-Teacher Association. And then they normally do things together with this association. And we need to get this a bit clear here. We are not forcing vaccines down the throat or the deltoids of children.
Yeah, I appreciate that. I just want to know if parents have to give their consent.
What they are saying is that, so yes, what they are saying is that the school authorities are actually engaging the parents to get this activity done. So it is a process that has started. And so there's engagement. And it is not like compulsory that every child should get vaccinated. Okay. The issue is we are looking at the benefits of getting vaccinated against not getting vaccinated. So, and we're saying that there's that option is available.
Okay, so where in the process are we? Is this something that is already happening on the ground in the schools? And are we talking about public schools, private schools, boarding schools, day schools?
It's all persons in Ghana who are between the ages of 15 and 17. As I said, the original vaccines were for persons 18 years and above. Now there's evidence that you can give Pfizer even as low as 5 years. We need to base our actions on the evidence. And we are saying that we applied to FDA of Ghana.
Yeah, we got that. I just want to know if it's already been rolled out, so that today in some schools, whether public or private, children 15 years and above are receiving the jab.
Yeah, so let me say that it's a case by case basis, and we've actually started in some schools. I don't have the numbers, but based on it's not every region that has it. So it's case by case basis. But one thing I want to stress is that we have some AstraZeneca that we want to exhaust before next week. So our focus now is to get rid of that, and then we'll focus more on the Pfizer too.
Okay, I want to bring in Kwame Sapon Asiedu here. And one of the things that we always benefit from when you join our conversations is that you have this global view of how the vaccine is being managed, where it has worked and where it hasn't worked, and so forth. So with this new directive for the 15 to 17-year-olds, your first cousin, as I learned, Franklin Asiedu Bekwing, has explained to us the reason why government sees this as important, and I think it makes sense. But the question parents are asking is whether or not their consent should be part of that process. How is it done elsewhere, and what's best practice?
Thanks, Kojo, and good morning to your listeners again. Truth of the matter is, I need to make a disclaimer here. I've got 4 children, and 3 of them are already vaccinated. My third one, my daughter, got vaccinated about 6 weeks ago. She had her first dose, and she's only 14. So I am talking from a point where I've had to make that consented decision based on the evidence that I see. So I'm not talking out of vacuum. The point we need to understand is that, and I have said this a number of times, when any medicine, and for that matter, a vaccine comes onto the market, you need to accumulate the data and do what we call a benefit risk assessment based on what we call the adverse drug reaction profile, which is what side effects you are getting based on the numbers of the medicine you are deploying. Initially, that was where the brouhaha with all these vaccines came. If you remember, that was where the issue around the blood clot came with the AstraZeneca vaccine. And I remember on one of your shows, this question being asked, and I did say that actually the incidence and prevalence of that was so low that there was even an issue that was of more concern with the Pfizer vaccine.
Yeah.
But because the numbers were low, we couldn't talk about it. That now has subsequently been reviewed. And there is no difference between the incidence and prevalence of that or the blood clot in the AstraZeneca vaccine.
Right.
So yesterday, the European Medicines Authority authorized the use of the Pfizer vaccine in children from 5 years upwards. It's already been done in the FDA in the United States. The MHRA in the UK probably is going to come out today. And I know the WHO is probably coming out on Tuesday. The point then becomes these children are under the care of parents. And therefore, because they haven't reached the legal age of consent, their consent is derived and therefore it has to come from their parent. So in my case, I was sent a letter for me to consent for my child to have it. But then the letter also went on to say that if I decided not to give consent, a child above the age of 15 could opt in if they disagreed with me. Why do I find that important? I find that important for a number of reasons, and it goes down to what vaccines are doing. And I'd want to draw everyone's attention to what has happened in the north of Ghana with this yellow fever issue, and why I think that this decision by government is right. If you look at the yellow fever issue, if you look at Ghana's EPI, the Enhanced Program for Immunization, for a long time, we have always hit over 90% of our target population. In fact, we are one of the highest in the African sub-region, sometimes around 98, 99%. But as you'd hear of all vaccines, a vaccine has an efficacy. So that's why you hear 70 and 90% here. And then initially, that was where the confusion that is one vaccine better than the other. The point is that the vaccine efficacy has two components. There's the personal efficacy, which is the protection it gives to you, that is what you talk about, the 70% or 90% and all that. And then there's the community protection, which is where you constrain the virus to a point that it can no longer spread. So even the people who are not vaccinated do not run the risk of getting infected. That is where the herd immunity threshold comes in. If you look at Ghana's population census, which was just released, over 40% of our population, in fact, it's just over 40%, about 40.9%, are below the age of 16. Now we have a virus which has a reproductive number of between 6 and 8. And I must draw your attention that there's a new mutant which has just come out now, which is causing a bit of hair raising on the platforms I sit, to the point that the UK has banned 6 countries from South Africa from entering. So the reproductive number may even change further, which means that you have to vaccinate about close to 90% of your population to constrain the virus. If we stick to our age of consent, which is 18 years, we wouldn't even hit 60% of our population. So we'll be running hares and rabbits. As a result, we need to get in more people, but get them in a manner that does not also risk their lives. And that is why initially the emergency use authorizations started from 18 years, then it dropped to 16, then it dropped to 12, and it's now dropped to 5. Because you must bear in mind that now billions of doses of these vaccines have been given. So the data is accumulating and the adverse drug reaction risks are being analyzed. So I have no problem with children around that age being vaccinated. Where I have a concern is about how the consensual obligations would be realized. And that is why I hear Kofi say that they are going to do it through the PTAs. That, for me, has always been the historical position of Ghana. Even when all of us went to secondary school, a lot of decisions were taken by the parent-teacher associations, because not every parent can fiscally come to Adisada or St. Augustine's or Infant Spring to help with the decision. So their association takes a collective responsibility for taking some of the decisions on their behalf. If that is happening, for me, that is fine. But I can also see a situation where the PTA would take that decision, but one parent will say, I still don't want my son or my daughter to have this vaccine. And I think that is what maybe the Ghana Health Service might have to factor in. But by and large, I think this is watertight.
Right. So I think from both of you, we've got the understanding of, first of all, the need to do this and the wisdom of doing it, as in, the fact that it will lead us closer to that herd immunity that we seek. Without it, we can't get that. So that is understood. And the reason and the advocacy for parents to encourage their children to do this is also understood. But there are some instances in which these vaccines elicit a negative result, maybe because of a pre-existing condition and so forth. Would it not just be right for parents who know their children's health histories to be involved in the decision before a vaccine is administered?
Well, Kojo, let me. When I get asked questions like this, and that was why I brought in the issue of the yellow fever. Historically, you call it, their vaccine coverage is much lower than Ghana, into Ghana. What's happening is they are coming into a population pool. That herd immunity threshold drops. So you have more people unvaccinated than you have vaccinated. And then they start infecting the few who are vaccinated, or seeing deaths in the savannah region, which is that in the agency. The question you ask about the parents knowing the health state of their children is valid with COVID. I suffice to say that when it comes to COVID, age is a determinant of adverse outcomes. So from ill health, hospitalization, severe mutating, and sometimes significantly, the new mutant you see has 30 mutant points on its spike protein. That is crazy. We don't know what it is going to do as a result and whether it's even going to change the mortality dynamics. So for me, and the regulations in the UK changes, because I am not going to hedge my bets with a virus that is this diabolic. And the spot to make those decisions. I have made them, I am making them, and I'll continue to make them. And apart from that, I am looking at the data from a scientific standpoint, and I am advising.
Once we're talking about our population, and we're talking about about 40% being below 16. So we said we're going to vaccinate 20 million Ghanaians by end of 2021. Dr. Asiedu Bekwing, it's the 26th of November 2021, just about 35 days to the end of the year. How many Ghanaians have been vaccinated so far?
Yes, thank you very much. Let me say that I want to use this opportunity to appreciate the work done by the health workers. The president apparently gave the directive that we want to vaccinate 20 million Ghanaians by the end of the year. It was based on a premise: one, the availability of the vaccines, and then two, the uptake. So we had a challenge at the early stage. Let me say that Ghana, because of our very efficient EPI system, we were the first country that had the COVAX facility of 7,000 doses. So initially there was an enthusiasm, a drive by the Ghanaian. Then we had all this hullabaloo about the side effects of AstraZeneca, and then the sudden disappearance of all the vaccines. So we were kind of shut down. And let me say that over the past 2 months, we've gotten several doses of the vaccines. And as and the sources of the vaccines are from the COVAX or from
yes, but Doc, my question is, how many?
I'm answering your question.
Okay.
Yes.
Go ahead.
So the as at 2 days ago, we had administered 5.007731 doses of the AstraZeneca, of vaccines. And if you look at it by as a country, we have 20% of Ghanaians that have received at least a dose. And then we have 6.1% that are fully vaccinated. But that's why I'm saying that now that we have the vaccines, our drive is the uptake. And that's why first I appreciate the fact that you have actually mounted that stand. So our issue is now we have vaccines. What is required for Ghanaians is to take the vaccines. And that's why I was saying that I had to appreciate the world workers. For October, we had almost 2 million doses of the vaccines from the German government. And we used 99% of that. As I speak now, for the month of November, we have also some doses from Hungary, and from the records that we have used almost about 80-something%. So we are on course. I don't know whether we'll get all the 20 million.
So
but
far,
what is good?
So far, how many doses of the vaccines are left unadministered?
I would say there are 6 million.
About 6 million.
About 6 million. Yes, about 6 million. Because we had 3 million just 3 days ago. So because of our deployment rate, we get influx of vaccines every passing time. We just used to be 9 million a few days ago. Then we had COVAX, we had other partners bringing it. And it's good for the country because they think that we can actually deliver and they are bringing it. And it's good to make sure that we get close to our target. So for now, I would say that we as a service, as a country, we are still going for the 20 million. And we are expecting 7.1 million by the end of the year. So if you add that one, in that case, we are looking over about 20 million doses.
You talked about receiving 20 million in October and administering about 99% of it. Now,
no, I said 2 million. 2 million.
Yes, I said 2 million. 2 million in October, yes. And administering about 99% of those 2 million vaccines.
Yes.
So if we look at the October figure, when we compare that to the November figure, that's also around similar margins. How feasible is it to reach 20 million? You're expecting 15 million. 15 million within the next 30 days.
As far as we are concerned, we are going until the last end. So we are going we are getting the vaccines. And you see, it is a collective effort. And I think that you didn't mount the stand at your place for that. It's to get Ghanaians vaccinated.
Exactly.
The issue is that the vaccines must be available and they must be uptaken by the Ghanaian. You cannot just say you want to take a vaccine if there's no vaccine. So first, the vaccine must be available. Two, the Ghanaians must take it. And that's why we are working together. So we are getting the vaccine from bilaterals, from COVAX, and we are trying to make more noise. The Ghanaians realize that you need to take the vaccine. We are getting into Christmas, and anything can happen. So we need to forgo what happened last year and make sure that we take the vaccine so that we do not have the fourth wave. Now, countries that have even gotten population immunity of around 67% are going to lockdown. If we have just let's say 20%, then we are way behind. So I think that for us as a service, our direction is the uptake of vaccines by Ghanaians. That for us is our goal now.
Dr. Asiadubeku, just some clarity. You mentioned that we have some AstraZeneca vaccines expiring soon. How much of that do we have, and what's the plan to get it administered on people?
Yeah, so what we do now, we do daily recall from the regions, and they also do daily recall from the districts. As I speak this morning, Upper East had done 98.6%. I mean, averagely, you will say that about 80-something% have been covered. I think the only challenge was water media. But let me say that Volta region is doing very well over the past few days. It was a challenge. There were instances that somebody had actually composed a song against the vaccine. So you could see that there was actually a bit of hesitancy. But the minister of the regional minister has actually issued a statement, and I don't know whether you have it, to the media, to the all key stakeholders about the need to get vaccinated. And we're thinking that when that comes up, I'll be surprised that we get about 90% of the vaccines. You see, there's a challenge. At times you get the vaccines and you have just about 3 weeks for it to expire. Do you take it or not? But we take it, and that's why we actually engage our health workers, and then we are always on them to make sure that we actually consume this vaccine.
So how much is expiring soon?
What I'm saying, we had 900,000, but I'm sure maybe I'm not sure of the figure, but it is very, very few. As I said, the October one, we consume 99%. Let me say that in terms of consumption, apart from Cote d'Ivoire, Ghana has the highest rate of uptake of vaccines in terms of deployment. So and that one actually motivates other countries to give us vaccines. This one, I'm sure we are going to get about 90%. It's 3 days yet, but we'll get it.
Right. Earlier you were talking about the sources where these vaccines have come from. Have they all come from donor agencies, or has Ghana bought any vaccines?
Yes, so by our plan, Ghana has actually committed to buy 70 million doses of Johnson & Johnson by the AVAT facility. So you have the AU member states, a World Bank facility, and by that direction, we are buying 70 million doses. We also have the COVAX facility that gives us over 12.4 billion doses. Then we have other bilaterals who are giving us the vaccines. So as I speak, the 12.1 that we've gotten, the AU facility, WPay, has given 2.7.
You said
then
we pay.
Pardon?
You said we pay for that?
Yes.
Ghana government pays for that?
Okay. Yes, Ghana government.
Uh-huh.
Yes. And then we have the bilaterals that are also given 2.5 million. And they have COVAX that has given 6.9. So if you look at it, the COVAX facility is giving 57.2%. Then the bilaterals 20.6%. And then the one that we are paying is 22.2%. So that is roughly the distribution. But the majority of our vaccines that we projected is actually going to be borne by the government, because that's the AU facility, the Johnson & Johnson. And the issue is that the spread is over a period of time up to 2022, 2023. So that's why we are filling it in with the bilaterals.
All right, thank you for that. Listen, let's wrap this up. I would love to get some advice from each of you, because we are trying to create the awareness for people to get vaccinated and to stay safe. So I'll start with you, Dr. Sapon Asiedu. We'll take your advice, and then we'll come to Dr. Asiedu Bekwin for his as well. I think you might have to unmute your microphone for us. There you go.
Thanks. Yeah. The only advice I would give is that, Kojo, we are not out of this yet. Like Franklin said, I live in a country that has double vaccinated 71% of the population. 71 cases, predominantly in those between 5 and 15 years. The unfortunate thing that the threshold, so we are seeing deaths, which in context are relatively low, on average about 150 deaths a day. And you'd cringe to hear me say relatively low, but you have to bear in mind that that pairs to the 2,000 a day we were seeing same time last year. So we have a decision to make here as a people, whether we are going to constrain this virus and lead our life and learn to live with it, or we are going to play Russian roulette, be vaccine hesitant, even with vaccines available, and keep the virus spreading in our society. And I'll end by saying this. The latest mutant that we have that is causing everyone to panic is out of Botswana. It is out of Botswana because, and it's only been discovered because African countries sequence very little of people who get infected. As a result, there could be a mutant that is spreading somewhere in West Africa that no one knows. The point is that the UK contributes over 50%. They react, and that's why the UK is the first country to react. So we don't even know if there are mutants circulating in Ghana that are of concern. The only way we can prevent that is if we all get vaccinated. Because if you look at compliance with protocols, it's next to nothing. I left Ghana not too long ago, and I saw what was going on. So our only saving grace would be to get vaccinated. Thank you.
Thank you, Kwame Sapon Asiedu. Dr. Franklin Asiedu Bekwin.
Yeah, so thank you very much. Let me add to what Kwame said. I think that I went for an event last week and I was surprised somebody was going to shake me. And I said, are we going back? So I think that we getting low figures in the country, but that does not mean that Ghana is out of the woods yet. To me, we can only be out of the woods yet when there's a global halt to the pandemic. So for now, our sure bet is to get vaccinated. And as we are entering into the Yuletide, I think that it will be frightening to get close to masses of population. We need to get vaccinated. I mean, that is the only sure way that we can remain safe. And let me also add that we still need to abide by the protocols. I will always wear a mask until WHO declares the pandemic over. I want Ghanaians to know that even though you are vaccinated, you still need to follow the protocols. And I want to urge all Ghanaians that let's fight this pandemic together. The fight is we and you. Thank you very much.
Thank you. Thank you very much, Franklin. Dr. Franklin Asiedu Bekwin from the Ghana Health Service. You also heard from Dr. Kwame Sapon Asiedu, who speaks to us from England. God bless you both.
Just an update on the schools receiving that directive from the Ghana Health Service. A very good friend of mine who teaches in a public secondary school says that they've given consent slips to send home so that parents can endorse them before the process begins. And they just did this on Wednesday. So if you're a parent, you should look out, talk to your children.
This compulsory, why haven't I heard from it? Then it's important for other schools to follow that example and communicate with parents. But clearly, let's get this immunity underway. All right, there's more to come.
But just before we go, we're still reminding all of you, our listeners, that look, we're still vaccinating. The Pfizer vaccines are here. So just come to the car park here at Joy FM.
Please come.
You'll be given the opportunity to be vaccinated. Please, you've heard it. It's very, very important. We are not out of it yet. And so why don't you just, drive by and get vaccinated?
Bring along your national ID. It's important.
Very, very important.
Yeah. All right, more to come. We're asking that question. Qualification or experience? Which one gets the job? After these.